please.
Powell is,
How you doing?
How you doing?
You got a meeting.
Powell is absolutely
No,
no.
she's on.
No, Commissioner
L.
Powell is here.
Oh, I'm sorry.
Okay, all right, cool.
And
Hi.
where are you attending from?
You know, I think I have to leave.
I'm in Pontiac and a health issue is why I'm not there.
Oh, okay, I'll figure it out now.
Thank you.
Thank you.
Hoffman,
But I saw it.
Hoffman?
That's probably Cinda.
Hello, here.
A
McGilvray,
reminder.
Here.
Jackson,
Here.
Nelson,
She's here but not in the room.
right, I'll call her.
Yes.
Cavell,
Here.
Gingell,
26
Here.
and 4.
Kuhn.
Yeah, you want me to send it to you or
I
something?
think I saw it.
I don't see him.
I just,
He did contact, Commissioner Kuhn contacted me yesterday.
Okay.
Reporting
It
his
sounds good.
inability
Thank
to
you.
be here.
But he may join
Yes,
via video. So Lubes,
here.
we have a quorum.
Thank you. All right, please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next on the agenda is approval of the minutes dated October 5th, 2021. I have a motion by Commissioner Gingell, support from Commissioner Hoffman. All in favor say aye.
Aye.
Opposed? Motion is carried. Next item is approval of the agenda. A motion by Commissioner Nelson, support from Commissioner Gingell. All in favor say aye.
Aye.
Opposed? The agenda is approved. Next up is public comment for items on the agenda. Is there anybody from the public that would like to speak to items on the agenda? All right, public comment is closed. Next up is communications. We have one item. The report from the Haven, the fourth quarterly report for the fiscal year October 2020 to September 2021. I have a motion by Commissioner Nelson, support from Commissioner McGilvray to accept the communication item. All in favor say aye.
Aye.
Opposed? Communications are approved. We have nothing under the consent agenda. Moving on to our regular agenda. Our first item is a contract with the City of Southfield for police officers, drivers training. And Under Sheriff McCabe is here to speak to that, but I need a motion. Motion by Commissioner Nelson, support from Commissioner McGilvray. Thank you.
Good morning. This is a training that we are doing for Southfield PD, and the next item on the agenda is the same thing. They're reimbursing us our total costs. Southfield was the first department actually that we trained in PTT about 3-4 years ago, so they're going to get recertified. What this does is teach them to high-speed pursuits, high-speed driving. It's just not about pursuits, but one of the main things is what is called the PIT technique, PIT, and that's where you come up to a vehicle that's not stopping at a certain speed, generally below 50 miles an hour. You hit it at a certain angle, it spins it around, and it ends the pursuit, and hopefully, and then nobody gets injured. Ideally, nobody gets injured. So Southfield's asked us to do this. We're happy to provide it. This will have to be done down at Schoolcraft Community College because that's the only track we have available to us right now.
Thank you. Any questions regarding this item? All right, roll call, please.
Would you like to prompt the vote?
Is everybody logged in? Ma'am,
I'm a yes. Just so you know, I'm a yes.
we'll do roll call. Roll call, please.
Okay. Powell is a yes. Hoffman,
Yes.
McGilvray,
Yes.
Jackson,
yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell.
Yes.
I still don't see Kuhn. Lubes,
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Next item is under Sheriff Reports is similar, the agreement with the Charter Township of Shelby for police officers, drivers training. I have a motion by Commissioner Gingell, support from Commissioner McGilvery.
Same thing as just with the city of Southfield. These are our neighbors, those not familiar geographically, immediately to the east of Rochester Hills and Rochester. They share our 6-mile border with us.
Thank you. Comments or questions? Commissioner Cavell?
Thank you, Chair. Under Sheriff, Shelby Township's in Macomb County, right?
Yes, it is.
Why doesn't Macomb County do this?
That's a good question. I can't tell you. Macomb County Sheriff doesn't offer it, so.
Okay.
We're one of the few agencies that actually do this. I know the state police. It's upfront costs are very expensive, and in order to have, we're doing it on overtime, so we're getting reimbursed for the overtime, but it is a large undertaking. So we're happy to provide the service because everybody in southeast Michigan hopefully remains safe as a result.
Thank you.
Yes, sir.
Thank you. Anything else? Roll call, please.
Hoffman.
Yes.
McGilvray.
Yes.
Jackson.
Yes.
Nelson.
Yes.
Cavell.
Yes.
Gingell.
Yes.
Powell.
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Our next item, also from the Sheriff's Department, is the 2021 Law Enforcement Service Agreement with the Somerset Collection. Who would like to make a motion? Commissioner McGilvery, support from Commissioner Gingell.
This is a contract, we did this last year also. It's for the upcoming Christmas shopping season. We'll have mounted unit horses in the parking lot during the dates that are within the resolution, and Somerset is reimbursing us the entire cost in order to perform this. In case you're not familiar with it, our mounted unit are all part-time deputies. They all go through the Reserve Academy at Oakland Community College, have to pass a complete background test, same as a full-time employee. They're basically treated the same as a full-time employee before they're hired in. And we have about 20 horses right now, and these are some pretty dedicated people. They undergo a lot of training, and they provide the horses. We don't buy the horses, and they feed them and do everything else, so it's a great benefit to all the citizens of Oakland County.
Thank you. Commissioner McGilvery?
Yeah, what exactly is it that they're doing on horses?
Patrolling the parking lots. They had thefts during the year, well, actually earlier in the year last year, so it's more of a deterrent than anything else, and plus people like to see the horses and pet them too.
Okay.
Anything else? Roll call, please.
McGilvray.
Yes.
Jackson.
Yes.
Nelson.
Yes.
Cavell.
Yes.
Gingell.
Yes.
Powell.
Yes. Yes.
Hoffman.
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Thank you. All right, next item is the 2022 Oakland County Narcotics Enforcement Team Burn Grant Acceptance. Motion by Commissioner Hoffman, support from Commissioner Nelson.
This is our annual burn grant application, and we're asking you to accept the grant today from the state of Michigan. Those of you that don't know, Burn is named after a New York City police officer that was killed in the line of duty many years ago, and that's where the name comes from. This is a multi-jurisdictional drug task force that started in 1971 here in Oakland County, and we were the leaders. We were the first multi-jurisdictional task force in the state of Michigan going back to 1971. The departments besides the Sheriff's Office that participate are Auburn Hills PD, Birmingham PD, Bloomfield Township PD, the DEA, Farmington Hills, Ferndale, Franklin, Hazel Park, IRS, Madison Heights, Rochester City, Royal Oak. Southfield is temporarily out, but is going to get back in, Troy, Waterford, and West Bloomfield Township. And we're asking for acceptance of this grant today. We are pleased to report that we actually got we're getting the same amount we got last year, but that's an increase over, we complained a lot that we weren't getting our fair share here in Oakland County, so it started to pay off a little bit. If you go back to fiscal year 16, we only got $134,000. So the state actually called us one of the elite teams that's doing a great job, and the rewarding teams that are doing a good job. Our primary focus is methamphetamine, cocaine, heroin, and fentanyl, which are the 4 biggies right now.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. Just going off of the drugs that you just mentioned, I noticed that those are the focused, targeted drugs for fiscal 2022. Do those change? I don't remember, I can't recall back to.
Heroin's made a huge comeback. Yeah, it does change.
Okay.
Methamphetamine used to be what they called the one-pot methods.
Sure.
That's have gone by the wayside, and methamphetamine is it's pouring over the border in Mexico, unfortunately, and it's become a huge problem. It's it's not good, but we're doing our best, and we're working with the federal government to hopefully shut that pipeline off.
Excellent. And is it fair to say that then those are priority targeted drugs for here in Oakland County?
Yes, ma'am.
As well as that nation?
It's statewide and
Statewide.
probably nationwide. You know, we don't do marijuana investigations anymore. Obviously, the laws on that's changed. So these are the 4 that are the biggies. Yeah.
Excellent. Thank you.
Thank you. Any other questions? Commissioner Cavell?
I have 2 questions. First, this, if I understand right, is already written into the budget. So is there a budget amendment required?
No, sir. It's a grant acceptance, and the matching funds are there.
And the matching funds are already written?
Yes, sir.
Okay, thank you.
In fact, it's a reduction in the matching funds from the previous year.
And that was my second question. How did you find a way to save
Well, we got a little bit more.
$20,000?
As you can see, when the year before, we budgeted more because we weren't sure how much we're going to get. So because we're getting more, we're able to reduce the match a little bit.
Okay, thank you.
Yes, sir.
All right, anything else? Roll call, please.
On item D, Jackson,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman.
Yes.
McGilvray,
Yes.
Lubes.
Yes,
You have 8 yeas, 0 nays.
motion carries.
Thank you. Have a good day.
Thank you.
Take care.
All right. Next item is a grant acceptance for fiscal 2022 crime victim rights. I have a motion by Commissioner McGilvray, support from Commissioner Jackson. And we have Kelly Fitzpatrick here to speak to this item.
Yes, hi, good morning. I'm here representing the prosecutor's office on behalf of Betsy Haig. So this is the 30th year of grant acceptance for this program, which provides for reimbursement of 7 full-time and 1 part-time county-funded position. These positions provide rights mandated under the Crime Victim Rights Act, such as victim notification, as well as personal advocacy for victims of crime.
Thank you. Comments or questions? Commissioner Cavell?
Thank you, Chair. Hi, Ms. Fitzpatrick. Do the victims of crimes include people who've faced like domestic violence or intimate partner violence? We're starting a conversation around here about Haven, so do you interface with them at all?
Yes, we do. We do collaborate with Haven. Typically, we assist families of homicide victims. Those cases are automatically assigned to our victim advocates. However, assistant prosecutors do request court advocacy for other types of victims as well, including domestic violence.
Okay. And when you say then having a victim advocate, do they do anything that complements what Haven does through their START program for domestic violence victims?
No,
Okay.
I don't believe so.
Okay. So can you tell me a little bit more about what a victim advocate does, so I understand?
Sure. So we field, the advocates field phone calls on a daily basis from crime victims. They assist victims and educate them about the criminal justice process. They provide court advocacy where they actually attend court hearings with the victims, and they provide notifications to victims throughout the court process to keep them informed.
Okay, thank you.
Mm-hmm.
Any other questions? Roll call, please.
On item E, Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman.
Yes.
McGilvray,
Yes.
Jackson,
Yes.
Lubes.
Yes,
You have 8 yeas, 0 nays.
motion carries. Thank you.
Thank you, everyone.
Our next item is a grant acceptance for fiscal year 2022, Raise the Age grant from the Circuit Court. I have a motion by Commissioner Nelson, support from Commissioner Jackson. And John Cooper Ryder is here to tell us more about this. Thank you.
Hello. Hi, yes, my name's John Cooper. I'm the business manager for the Circuit Probate Courts. We're here today for grant acceptance of $750,000 in grant funds from the Michigan Department of Health and Human Services to help pay for the juvenile justice services for youth. Per Raise the Age legislation, which was passed in November of 2019, to be effective this October 1st, MDHHS is to reimburse 100% of the cost of providing juvenile justice services when the court takes jurisdiction over a juvenile who is 17 years of age, but under age of 18 at the time of the offense. There are two ways to get reimbursed for these expenses. The first one is via the Raise the Age Fund, which is administered by MDHHS through their electronic grants management system called eGrams. These are general fund type expenditures that are not reimbursable through the normal child care fund reimbursement processes. This is the method for seeking reimbursement of the $750,000 grant funds that we're here for today. These are for expenses such as defense attorney fees, interpreter fees, other case-related fees, as well as casework services for of a non-intensive nature. The second way would be through the normal child care fund reporting program process for typical eligible child care fund expenses, such as placement costs and intensive services. We aren't worried about that second method today. I just wanted to give you the big picture, full picture of how do we get reimbursement through of these funds. But that's, I think that's it. And I'm here to answer any other questions that you might have as it relates to this.
Thank you. Any questions? Roll call, please. Oh, Commissioner Jackson?
Oh, no.
Okay, roll call, please.
On item F, Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGilvray,
Yes.
Jackson,
Yes.
Cavell,
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
All right, thank
Excuse me,
you.
I didn't
Thank you.
get to vote.
Commissioner
Oh, she
Nelson.
said my name
I-
twice.
Oh, I'm sorry, Nelson.
Yes, thank you.
Sorry about that.
That's okay.
Thank you. This Raise the Age grant is one we're particularly proud of, so thanks for your work on that.
You're welcome. Thank you.
Our next item is creation of one full-time judicial staff attorney position through the Circuit Court. Who would like to make a motion? Motion by Commissioner Nelson, support from Commissioner Hoffman. And we have Kevin Offner here to speak to this item.
Yes, thank you. Good morning, Commissioners. I want to thank you, first of all, for placing this item on your agenda and for giving us the opportunity to discuss this matter with you today. If approved, the resolution would allow the Circuit Court to create one full-time judicial staff attorney position to enable us to meet what is a kind of a considerable workload need that we've been experiencing for some time. The position would be housed in court administration, and we would have it working in a couple of areas. One, it would assist the judges with things like summary disposition motions, 6,500 motions, which are motions that are filed by defendants to set aside or modify their judgments. We get a lot of those. And also it would assist the judges with criminal appeals. It would also assist court administration with legal research and providing recommendations on operational and/or procedural changes that we would have to implement to ensure compliance with court rulings with new statutes, with new court rules. There have just been a bunch of those lately, some of which I'm sure you're familiar with. You just approved the Raise the Age legislation grant. We now have jurisdiction of 17-year-olds in our family division. That just started October 1. You're probably familiar with the conviction set-aside legislation, otherwise known as the expungement legislation. There have been jail and pretrial incarceration reforms that have been enacted recently. There are juvenile justice reforms coming. We anticipate a series of bills that will change how juvenile justice takes place in Michigan. And then we've had even things like e-filing now for criminal and possibly juvenile cases. So we need to have somebody on staff with a legal background who can make sure that we're following the procedural requirements that we need to follow and giving our judges the appropriate advice to make sure that we're doing the things that we need to do that would be in compliance with all these amended court rules and new statutes and so forth. And then finally, the judicial staff attorney position would assist in providing coverage for our judges who are experiencing absences of their staff attorneys due to extended leaves and unanticipated vacancies. We've been hit with a number of those recently. In fact, I think even right now, we have 3 staff attorneys who are either out on maternity leave or short-term disability. We've had one that's been out since May, and we're not sure if that person will even come back. And so because the staff attorneys are so integral to the judges to be able to manage their dockets, the staff attorneys are writing opinions and orders, meeting with parties, trying to help settle disputes. We need to make sure that we provide the kind of resources that we can to our judges so that they can continue to manage their dockets. Now, we know that we're asking for this position about 3 weeks after you just adopted a balanced budget. And so to ensure the integrity of the fiscal responsibility that's encapsulated in that budget, we recommended to the bench some existing line item appropriation reductions to fully offset the cost of the position. The bench approved our recommendation. We sent it to the county executive's office, and the county executive basically has approved it and supports our request. So for those reasons, we're asking for the position to make sure that we can cover what is a considerable need for the resource. We did pay for the position, and we also want to make a commitment that we'll continue to work toward achieving our 5-year workforce management plan reduction target. The county executive's office was very satisfied with the reductions that we made in personnel costs in our budget for fiscal year 2022, and we're continuing to work on those on a 5-year basis. And so this position, if approved, will not impact our ability to be able to continue to move toward our 5-year target. So, Commissioners, that was kind of quick. I apologize for that. We ask for your support of the resolution and would be happy to answer any questions that you might have.
Thank you. You are busier, including our expungement and raise the age and the many things you do with less staff. Any questions? Commissioner Genzel?
Thank you, Madam Chair. Hey, Kevin, how are you?
Good. How are you doing, Commissioner?
I am good. You covered my question, actually, and I just wanted to say thank you. I was wondering if this position was included in the budget we just adopted, but you responded to that with an additional response that said, however, you're able to fund the position through managing of other costs within your budget, so it's not an incremental expense that puts us out of balance with the budget. So I appreciate it. I just want to take a minute to recognize your proactive nature there, because if that hadn't happened, I probably would have had a problem with it, or at least figuring out how to solve the deficit. Thank you.
Yeah, thank you, Commissioner. I appreciate that.
Commissioner Cavell?
Thank you, Chair. Yeah, that was actually going to be my question, so I appreciate you mentioning that. But now, the way you filled this budget gap, if I'm reading this right, is by cutting juror fees and mileage, and among a couple other things, but that seems like a pretty big line item.
Yes, well, I think our I can't remember what our budget is now in juror per diem. John, is it about $400,000 or $500,000?
Yeah, 510,000.
510. And so obviously with COVID, we've had far fewer juror trials than we normally would have, but we think we can reduce, we're only reducing that line item partially, leaving the bulk of that appropriation intact. And we think we can even live within that appropriation even post-pandemic. It's going to take us probably a year or two to even ramp up the number of jury trials after the pandemic subsides. But also there's a new prosecutor and a new prosecutorial philosophy in Oakland County. She has given her assistant prosecutors greater latitude in charging decisions and also in plea bargaining. And so we really think that this is going to be a long-term sustained reduction in that expense. So that's why we felt fairly comfortable in reducing that line item partially.
Okay. And then the second question is, next fiscal year, you double the general fund transfers to help fund this position. How does that work, or am I misreading that?
Commissioner, I'm not sure what you're referring to there. John, do you know?
I'm not sure either, Kevin.
So in the resolution we received, it says $15,000 for fiscal year 2022 is transferred in from the child care fund to help cover the $111,000 salary. Then the plan for the next 2 years is to transfer first $31,000 and then $39,000. So that seems like doubling the general fund request. And then the pay also goes up by $17,000 for the person that you'd hire. So just not to split hairs, but
I think that's,
am I misreading that?
Commissioner, I think that's just a transaction, an accounting transaction that I can't really speak to exactly how it takes place, but it's really the three line items that are impacted of the juror fees and mileage. That's the one that we already talked about that Kevin had mentioned, visiting judges. And then the one that I think that is having an impact on this transfer is the state institution line item.
Yeah.
And that's just a small, very small piece of the state institution line item that we're tapping into there. And I'm not sure why there's transfers in and transfers out, but it has something to do with coming out of the child care fund and going into the general fund and vice versa. So that's
right.
That's my extent of the knowledge and the transfers in and out.
But so what I'm asking is, part of the way you're paying for this is through that state institutions line item, which in a budget we just passed 3 weeks ago, we said we needed all of that money, but now we need 15,000 less of that to pay for this new staffer. And then the next year we'll need 31,000 less to continue paying for this staffer. So I'm asking, and maybe I'm not supposed to be asking you these questions because it's not your department, so forgive me.
Yeah, Commissioner, I'm not sure. Honestly, I don't even know why that's in there. We're paying for it as a result of a reduction in three line items.
Yeah.
In our visiting judge line item,
Yeah.
in our juror per diem line item,
Yeah.
and in our state institutions line item. And I suspect what's happening, although I'm not certain of this, as I'm looking at the resolution now, I think because when kids are placed in out-of-home placements, there is a cost for that. The state picks up half the cost and the county picks up half the cost. If we're arguing that we're going to be placing fewer kids in out-of-home placements, and John, you can correct me if I'm not interpreting this correctly, I think this is reflecting that because there will be a reduction in the county portion of the cost to house these kids in out-of-home placements, there will be a corresponding reduction in the state's obligation as well. But honestly, I wish somebody was here from the budget division because I don't understand the accounting that's taking place here. I know that we're reducing three line items to pay for it. We submitted it to the budget director and he was satisfied that that would fully offset the cost of the position.
Okay. Thank you. I'm going to vote no now, just to clarify with Kyle what it is. But I appreciate what you're doing, and I think this is a very worthy thing.
Okay, thank you.
Yep.
Any other questions? Yeah, and I agree. Reducing out-of-home placements is the best avenue for children and families for support of them. All right, roll call, please.
On item G, Gingell,
Yes.
Powell,
Yes.
Hoffman.
Yes.
McGilvray.
Yes.
Jackson.
Yes.
Nelson.
Yes.
Cavell.
No.
Lubes.
Yes.
You have 7 yeas, 1 nay.
Motion carries. Thank you.
Thank you, commissioners.
Thank you. Our next item is the Huron Valley School District Interlocal Service Agreement Amendment Number 5 acceptance, which is, the amendment is looking at potential funding for the continuation of the groundwater monitoring program. I have a motion by Commissioner Hoffman, support from Commissioner McGilvray. And we have Leanne here to speak a little bit more about this item.
Good morning, everyone, commissioners. So this program we have actually been running for close to 10 years. And so what we do is we offer staffing that are familiar with sampling kind of as a third party to come in and do water sampling for the school district. And so back in 2010, there was some possible contamination. And so the school district was responsible and continues to do some sampling for some a residential area, looking for sodium, chlorine, chloride, and also hardness in the water. And so they have requested that we continue this interlocal agreement with them, and they pay us for the staffing time that it takes.
Thank you. Any comments or questions? Roll call, please.
On item H, Powell,
Yes.
Hoffman.
Yes.
McGilvray.
Yes.
Jackson.
Yes.
Nelson.
Yes.
Cavell.
Yes.
Gingell.
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Our next item is another grant acceptance for Transforming Youth Suicide Prevention 2022 programs. We have a motion by Commissioner Nelson, support from Commissioner Gingell. And Leanne is also here to report on this.
Yeah, so this grant acceptance is for the Transforming Youth Suicide, and actually looks at ages of young adult 18 to 24. They do call it youth suicide. But this really looks at a public health educator, actually a part-time public health educator that's grant funded, looks at creating programming and evidence-based trainings around suicide prevention. And so we use trainings like Safe Talk, Assist, Living Worth. And so we go out and educate and offer opportunities and education around this for law enforcement, first responders. We also offer the trainings here at the county. And so we really just look at opportunities to try to get the word out about avenues to take and work with this age group around suicide prevention.
Thank you. Any comments? Roll call, please.
On item I, Hoffman.
Yes.
McGilvray.
Yes.
Jackson.
Yes.
Nelson.
Yes.
Cavell.
Yes.
Gingell.
Yes.
Powell.
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Our last 3 items are also from our health department. The next is the fiscal year 2022 emerging threats, local health department agreement, final grant acceptance. I have a motion by Commissioner Nelson, support from Commissioner Gingell.
Hi, Yes, so this request grant approval is for funding just at $9.5 million. The focus for this is all around COVID. Also, so that's vaccination, immunization, contact tracing, case investigation, testing coordination, and also monitoring and wraparound services. Majority of this money is used for a lot of our contracted services that we bring in to assist us with these. And we're also for some of our lab services as we provide testing services as well. Just as kind of a heads up on this, and I'm sure you're hearing this coming out actually this week, we will be hearing about the Moderna and J&J booster hopefully being approved by CDC, so we can start rolling those out. And then by the beginning of November, starting to offer pediatric, which is 5 to 11 doses once that is approved. And so we will be working with contracted staff as well as our staff to really focus on that for the next 2 months and get pediatric doses out into the community. So that's what the majority of this money will be used for those items.
Thank you. Commissioner Gingell?
Yeah, I just have a question. Leanne, I appreciate what you're doing in the grant, but I also wonder, as this continues on, at some point the contact tracing, all the infrastructure that's been built. I have a relative that had COVID, went to the doctor, and within, I would say, moments or less, he's getting a call from the county and other places regarding contact tracing, et cetera. At some point in my mind, this normalizes, it levels off. If I get the flu today, nobody's calling me to say who have I talked to, walked around, been around. Flu kills probably as many people as COVID will this year, in my opinion. So I'm going to support accepting the dollars for the grant and continuing on what we're doing, but I also want us to start thinking about the mental shift. When COVID is normalized, it's going to be with us. People are going to get the vaccination. They're not going to get the vaccination. They're going to wear a mask. They're not going to wear a mask. I equate it to the flu because that's how I view it personally. And I just don't see us forever supporting all the expenses of all the infrastructure that we are putting in place. Just a comment.
Thank you. Any other comments? Commissioner Cavell?
I guess just to offer support to Leanne. The economy, our society is irrevocably changed because of COVID. Whether you agree with it or disagree with it, it's happened and it's happening. So as long as COVID's still what it is, I'll keep voting yes on these grants to help us figure out how to get ahead of it. So thank you, Leanne.
Anything else? Commissioner Jackson?
Thank you, Leanne, and I just appreciate your efforts in this time that we're in, and just want to make note that this grant agreement is for the period of October 2021 now through September 30th, 2022. And I know that we are still in the throes of all that is COVID, and hopefully by September 2022 it has normalized to the point my fellow Commissioner Angel has mentioned. But meanwhile, thank you, and thank you for supporting the development of a regional lab, because we know that this is not just a local issue. Thank you.
Thank you. Anyone else? Roll call, please.
On J, McGilvray,
Yes.
Jackson,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman,
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Our next item is the grant acceptance fiscal year 2022 local health department agreement final grant acceptance, which references the grants for Oakland Livingston Human Services Agency and the WIC program, Women, Infants, and Children. Who would like to make a motion by Commissioner Gingell, support from Commissioner McGilvray? Are you ready?
Yes, so this, Yeah, this grant acceptance is our large grant, right, that we get through MDHHS, which actually supports the majority of our mandated services that we do here at the county. You might have heard it CPBC. If we were on here for a little while, we talked through that. That's for this fiscal year. You know, this funds our, like you said, WIC, our restaurant inspections. It's our infant safe sleep. We get this is our HIV care that we get through here, hearing and vision. So many of the services that we offer here at the county is funded through this grant. We have 59 special revenue positions that are in this as well. Like I said, this funds the majority of the services that we provide here at the health division.
Thank you. Any questions? Roll call, please.
On K, Jackson,
Yes.
Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman,
Yes.
McGillivray,
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Thank you. Motion carries. Our last item on our regular agenda is the resolution to create a health program coordinator position for fiscal year 2022. And this would reference our HIV/AIDS unit and hepatitis C. A motion by Commissioner Nelson, support from Commissioner Hoffman.
So this resolution here is requesting, as you stated, to create a health program coordinator, which will oversee what we're calling our harm reduction program. And this is a range of services from linkage to care, access to and disposal of syringes and equipment, overdose prevention, vaccinations and testing out into the community. And then linkage to care for infectious disease. We brought a grant here. We have a grant where the programmatic staff actually work on linkage to care. And that's someone that is maybe been diagnosed with HIV earlier, maybe in the 80s and 90s and have kind of lost contact with us. And so it's re-engaging them and bringing them back into services. And so this program really focuses out in the community a lot, but we have 2 pretty large grants that right now staff are trying to oversee, existing staff, and so this position here would help oversee those grant programs, which are fairly new. We do have funding through the state that would allow us to pay for this, so this would not be coming out of general fund, and this is an annual funding that we receive each year, and it is written in as part of the state legislation that we would get this. It has to be used for very specific reasons, and so it has to increase mandated services, which these like HIV, hepatitis C is included in that.
Thank you. Any other questions? Commissioner Cavell?
Thank you, Chair. When I was reading the resolution, it says that this will sunset at the end of next fiscal year within the HIV/AIDS unit. Is that what you're saying is can you explain that more, please?
Yeah, so it's an annual funding, right? We know we will get it every year, but because it's not in our budget every year, we have to receive it through this special funding. It would sunset each year. We also have an opportunity, though, for sustainability if it was to go away for billing. So our nurse practitioners that are providing services as part of hepatitis C or this harm reduction, there is billing that goes along with that. And so that if this position was to this funding was to go away, we have sustainability in billing that we would be able to utilize that to pay for this position.
So are you saying that you need us to give you $83,000 from our general fund, or it's grant funded?
It's grant funded. It actually comes from grant funded. It's LCA. It's a very specific funding that's just for these types of services.
Okay, thank you.
Yeah.
Anything else? Roll call, please.
On L, Nelson,
Yes.
Cavell,
Yes.
Gingell,
Yes.
Powell,
Yes.
Hoffman.
Yes.
McGilvray.
Yes.
Jackson.
Yes.
Lubes.
Yes.
You have 8 yeas, 0 nays.
Motion carries. Thank you. Thank you for being with us. We are on to public comment. Is there anyone from the public who wishes to speak? So, yep, you are familiar. Come to the table, name, city, in 3 minutes.
Okay. My name is Deanna Jamil. I live in Walled Lake. I'm a mother of 2. I also have my master's in social work with 5 years of experience with Child Protective Services in Wayne County, 2 of those years specifically in Highland Park. So I have seen the worst of the worst cases of child abuse. With that being said, I feel what is being mandated on our children is child abuse, and I'm going to go ahead and read a resolution that was brought up by Adam Kochendorfer regarding the request for government transparency in health mandates, as I believe that we are individuals and we all have individual rights that I feel are being violated. Whereas, on August 24th, 2021, Oakland County Executive David Coulter, by and through an order of the Oakland County Health Division, unilaterally imposed a masking requirement on over 200,000 students beginning at 4 years old and recommended supervised masking for children at least 2 years old. And whereas Executive Coulter has repeatedly indicated that he will follow the science. And whereas shortly after the order was issued, the Detroit News quoted Executive Coulter as stating, "This isn't a political decision, but a health order. It was made with the best guidance of our public health staff." And whereas the statement is untrue based on emails recently uncovered through a request under Michigan's Freedom of Information Act. And whereas these emails demonstrate that the Oakland County Health Division initially proposed a significantly different order that was rejected by the county's executive's office. And whereas specifically the medical experts of Oakland County Health Division proposed that the mask mandate remain in effect until 60 days past the date COVID-19 vaccine is authorized or approved by the FDA and available to persons in pre-K through grade 12, or community transmission of Oakland County is categorized as low by the CDC for at least 7 consecutive days or until further notice from the Oakland County Health Officer. And whereas mere hours before issuance of the final order on August 24, 2021, the county executive administrative sent an email effectively overriding the Oakland County Health Division. And whereas specifically the county executive administration objected to the county health officer's decision to, after 60 days after FDA authorization for younger children. And whereas left with little choice, the Oakland County Health Division revised its decision and complied with the administration's preference to ignore the science. And whereas the final order renders vaccine availability irrelevant, simply stating that the unilateral mask mandate will continue until community transmission for Oakland County is categorized as moderate by the CDC for at least 14 consecutive days or until further noticed. Okay.
Thank you.
Finish another time. Thank you.
I have a public comment.
Oh, sure.
Or a
Welcome.
question, really. Hi, my name is Colleen Zamet. I live in Beverly Hills. My comment concerns the grant acceptance for the OCHD. I'm trying to find out more information, and so I really do have a question to go along with my comment. Based on a lot of reporting that I read when Governor Whitmer signed our budget just recently, I was under the impression that county health departments would not be receiving their state funding if they enacted a mask mandate for persons under the age of 18 years old without the support of their county board of commissioners. If that's true, I'm confused why we've just been awarded these grants. I don't know if I'm talking about the same thing here. And now, because your chairman, Dave Woodward, will not allow the topic to be discussed, I'm also under the impression that the Board of Commissioners has not officially supported or not supported the OCHD's K through 12 mask mandate. So I'm putting out this public comment to inform people and to ask questions. How is it that we received this funding when it was specifically included in our budget? I know that Governor Whitmer has said that the language is unconstitutional and therefore unenforceable. However, the executive branch does not have the authority to deem something unconstitutional. She can say it. It is her opinion. Only the judicial branch can decide if something is unconstitutional. Thank you.
Thank you. Anyone else for public comment? All right, public comment is closed. Any other business? Commissioner Gingell?
Thank you, Madam Chair. I just have one item that's a concern that's been recently brought to my attention through some news stories regarding private charter jets going from Texas to Westchester, New York, taking illegal immigrants from the border issue and displacing them or placing them through the Westchester County Airport. And I know on September 2nd, the board adopted an agreement with Homeland Security relative to Oakland Airport. And I think it is a matter of public health that we revisit that document and understand, did we allow and or approve the federal government, Department of Homeland Security, or immigration to utilize Oakland Airport in the same manner in which the Westchester Airport was recently utilized? I don't know that, and I'm not speculating. I just would like to be informed and have an opinion on that contract that we adopted. So if, Madam Chair, I'm happy to put the request in writing to you as the Chair of Public Health. I understand that requests for Corporation Counsel have to go through the chairperson of the board, so I can either direct it directly or through you, Madam Chair, as this committee, which I'm happy to do either and be respectful of whatever you would recommend.
But if you're able to ask the attorneys directly, do that, that might satisfy your answer before bringing it
Under
to
our board
us.
rules, we aren't, I believe.
Okay,
And when I
then
was the
send it to
chair,
me.
it always had to go through the chair.
Okay.
And I believe that's still the current process.
Yep, send it to me. Thank you.
All right, thank you.
Anything else? Then at 12:13, I will declare this meeting closed. Thank you.
Nice job, Madam Chair.
Okay, yes.
Pick up the time.
Yeah.
Make up.
I know.
Hi, I'm Colleen. I was treating